Good day everyone!
Hello everyone,
For today's video, we're going to demonstrate.
and teach you how to newborn care vital assessment,
I am Dr. Brady Banjola,
and I am Mahina Kitulabeg.
and we are your demonstrators for today's video.
So now we will present to you the instruments used in newborn care assessment or newborn vital sign assessment. So first thing is for thermometer, is for the temperature of the baby. This is also for the patency of the anal area of the baby.
We also have infant stethoscope, and for us to be able to know the heart rate of the newborn, we're going to use the bell of the stethoscope.
And for the RR, or the respiratory rate of the baby, we will use our eyes and observation. And also we can touch the baby for the assurance that we will take the respiratory rate of the baby.
Another supplies needed for the general characteristics of the newborn or the anthropometric measurements. We need the measuring tape, weighing scale of the newborn.
Good morning, students.
Good morning, sir. Good morning, ma'am. Good morning. So now we will demonstrate to you the newborn vital sign assessments.
I am Dr. Brady Banjola,
And I am Mahina Kitulabeg.
and we are your demonstrators.
Just a reminder, students, sanitize supplies before and after use, and also perform hand hygiene before and after assessments. When collecting vital signs on an infant or newborn, you will want to keep the following in mind. Start with the most non-invasive vital sign first. So here are the sequence for assessing. First is the respirations, heart rate, temperature, and then the anthropometric measurements, which are the head circumference, chest circumference, and abdomen, and then the length or the height, and then lastly, the weight. For the RR, normal respiratory rate is 30 to 60 breaths per minute or cycle per minute. Assess for any signs of distress like nasal flaring, chest retractions, and skin color. Count for 1 full minute. At this age, the rate is irregular, so you need to count for 1 full minute. Watch the rise and fall of the chest. 1 rise and 1 fall equals 1 breath. So tip, infants are abdominal breathers, so watch this area or lightly place a hand on the area while counting. For the heart rate or cardiac rate, use an appropriate size diaphragm and bell for the newborn or infant. The normal heart rate is 110 to 160 beats per minute. The apical pulse on an infant is found at the fourth intercostal space, lateral to the mid-clavicular line. The heart rate is going to be fast, so it will take you to practice when learning how to count the heart rate on an infant or newborn. For the temperature, the normal temperature range for an infant or newborn is 36.4 to 37.4 degrees Celsius, but other sources it is said 36.5 to 37.5 degrees Celsius. So route taken is via the anal area or the anus of the infant. So this is also for the checking for the patency of the anus of the newborn. Place the tip of the thermometer within the anal area or the anus of the newborn, and then wait for the thermometer to beep. Let's go to the head circumference. Use a measuring tape and measure in centimeters. Measure the largest diameter of the head. This is found around the forehead, just above the eyebrows, and the prominent part of the back of the head. So normal is 33 centimeter to 38 centimeter. For the chest circumference, wrap the measuring tape around the infant's chest and use the nipple line as a guide. The chest circumference should be about 1 to 2 centimeter less than the head circumference. It should be normally in 30 to 36 centimeter. For the abdominal circumference, place the measuring tape around the abdomen of the newborn or at the umbilicus line or above the umbilicus, and then it should be around normally 31 to 33 centimeter. For the length or height of the baby, you may need another person to help hold the infant still as you mark the length. Measured from head to heel and place the tape measure behind infant to mark length areas. Normally, the length should be around 17 to 22 inches, and for the centimeter, it should be around 44 to 55 centimeter. For the weight of the newborn, remove all clothing and place infant on the scale and obtain weight. Normally, it should be around 2.5 to 3.5 kilogram. Another thing in the newborn assessment is the APGAR scoring. These are activity, pulse, grimace, appearance, and respirations. While we take the vital signs of the newborn, we could also obtain the APGAR score of the newborn by observing the baby. So the scoring, it should be normally 7 to 10. This means there is absence of difficulty. And if the score is 4 to 6, this is moderate difficulty or moderate depression. This means the baby needs oxygen or suctioning. And if the score is less than 4 or 0 to 3, this means there is severe distress or aggressive resuscitation is needed.
And that's all for today's video.
Thank you for watching. I hope you learned something for today's video.
Bye!